I'm going to give a few disclaimers before I start this. I do make a few generalizations throughout here. I'm thinking bell curve. Yes, we all remember the outliers, and there are outliers, but I will make generalizations. Some are about men. Alex, I'll apologize in advance. Cameraman, you too. I am usually inappropriate. I will try very hard not to be, but I'm sure at some point I will slip and probably throw out a curse word or something, so forgive me. And I've noticed a lot of times when we have discussions or meetings, some of the argument that comes in is when we refer to international stats or international data. Well, that's not New Zealand. Veterinary medicine as a whole still deals with animals, and we will follow in the footsteps of the UK and the US and countries that are a little more advanced than us, and there will be countries that follow after us. So I will refer to some as international stuff. So there will be plenty of things that I talk about that. So just so we know those are out there. So can women work well together? So why am I giving this talk about women and not men? First, I do think we should all try to work well together, but this is a wives' talk. Women's the first word in it. So, and we know, just as Megan said, scientifically, it's proven. We know we're very different than men. We think different, we act different, we have different emotional responses. We all have vaginas, they don't. There's so many things about us that are just similar that we don't put up to. So there's a commonality. The population of our profession. In about the 80s, it was about similar, 40-50 difference. Now, as a whole, a population of veterinarians, 80% of them are females. In New Zealand, it's still about a 60-40, 60 being women, 40 being men, about. That will change and continue to change. We do fall out of the profession much more quickly, but basically on a scale, 80% now, you can see red being women, massive, massive change. So with that said, I also, if you notice, if you can't see it down here, about 1980, I have the word old. And about 2018, not old in age, but I'll use it again. So the changing landscape of our profession. 15 years ago, the things we learned are old school. 10 years ago, the things we learned are old school. 5 years ago, the things we learned are pretty much old school. Medicine changes every single day, and we have to keep up every single day. And with this graph, the majority of our newer vets are more up to date on current knowledge, and they're women. Therefore, with that said, by deductive reasoning, the men who are still in our profession are going to tend to be a lot more of the old school train of thought. Not all, but many are going to be. And I don't just mean in medicine. I mean, I can do it on my own, can do it by myself. We were just a lot less collaborative. So as a whole, it was different. Family life. I know some of us don't have families other than the four-leggers. But until men are taking maternity leave and having babies, or raising families at home, until men become house husbands instead of housewives, women will always have to work a little bit harder to stay up. We will always have to come back from maternity leave. We will always have to figure out that knowledge and that balance between running the household or going to work and do we have enough family time. And I think until we do that, it's going to be difficult. We have to find our different ways to do it. We have to elaborate. And I think one of those things is using the knowledge that we have around us. So why should we work together? Chance of malpractice. It's not a scare tactic. So fact-wise, and yes, I am using international facts, but from New Zealand Vet Council, last year was the highest rate of formal complaints laid against veterinarians in this country in the last 5 years. So it's going up. In the 70s, all you'd really get in a malpractice suit was the value of a pet. Could be $100. In the 90s, the highest recorded case was about $10,000. And the most recent recorded cases were $39,000 for a dog and $75,000 for a cat. And even more so than that, I mean, not a cat, I'm sorry, I lied, a horse. It was a horse. And even, not a cat. We'd all get cats. Even more so than that, the veterinary profession is now, our conduct is now being judged in parallel with other medicine professionals. Most other medicine professionals have $1 million of malpractice insurance backing them for a reason. So if we're being judged on the same symptoms and the same behaviors and the same code of standards that they are, we're going to fall into this category at some point in time. So why did I say all that? Because if we're collaborating, we have less chance of mistakes, which means less chance of malpractice. We have a network of knowledge. One of that, how do we work better if we're working less because we're doing other things? Even in this room, there is so much expertise in the chairs here, whether it's specialists or not even specialists, someone who's been doing 15, 25 years of work on cats. We have so much knowledge just around us that we could be utilizing. We know 2 heads are better than 1, or what if we have 15 we could utilize, or 20, or a country full of women that could work together. This is the big one for me. If we're making less mistakes, we're treating our patients better. It's going to be better care, no matter how we do it, no matter how we get to it. And that, for us, many of us, I think, is probably the big goal on that one. So, what holds us back? This is going to be the slide that I think will irritate some people, or it'll just ring true with you. And I think either of those responses says something. Because I think if we say, why don't we collaborate with each other? Well, I don't have time, or it takes too long, or how do I do it, or they might not know either. And I think if we said, oh, well, maybe you're a little afraid to, or maybe you're a little prideful. Of course not. That wouldn't be it. Fear. If I have to call someone to ask something, or I'm collaborating with someone about a case, it means I don't know. It means I have to admit that I don't know the answer, or I might not be smart enough or bright enough. Humility. If I have to call someone or ask someone or email someone how to do something, or is there a better way to do it, or how do they handle those cases, it means that they know better than me. We all learn the same things. We're supposed to be equal. We're supposed to be even, but we're not, because we don't all know the same things. Pride. I learned this. I started cleaning cages when I was 16. You got to sweat it out too. You got to figure it out. You got to learn it. And if I share my knowledge, you're going to know what I do. So I think that holds us back. And this one, it's a hard one. I think it sounds kind of dramatic, but everyone's touched on it. If we learn something, if I call Megan or Helen, or if I call someone and ask about a case, or I talk about a case, and I find out I did it wrong, how many cases before me did I do it wrong to? How many of my other patients suffered because I did it wrong? We in this profession hold ourselves to a standard that is almost impossibly obtainable. Any mistake we make, we take home, we internalize, we never forget it, we lay awake, we think about it the next day, we don't want to do the next patient, we don't want to mess up again. We tear ourselves apart, and all because we're going to make mistakes. So if these 4 things, if we actually broke it down and said, well, I don't want to call and ask, or I don't want to do this because I'm afraid, I think we'd be a lot less apt to not do it. Oh, no, I'm not going to be afraid. I'm not going to be prideful. And we do them. But we don't think about it like that. I think we make excuses because these are, well, for me, these are really hard things to think about yourself. So, how do we fix it? A few things. Pick out your strengths and know your weaknesses. Like, honestly, pick out your strengths and know your weaknesses. It's easy for me to say, I suck at orthopedics. I will throw up if I have to touch bones. That's why I send them all to surgeons. But it's easy to say that, but I'm also really not that good at skin, and I do skin every day in GP. So know what you're good at, know what you've learned, 15, 20 years of experience, 30 and 40 for some people. You know those things, and you know getting familiar with what you're good at and what you're bad at, first step. And the reason I say that, because start with one. One colleague, one friend, one coworker, one person sitting next to you that you have no idea who they are. Agree to go over a case. Could be your first case of the day, doesn't have to be. We do, one of the big things we did in the US was morbidity and mortality rounds. We don't do them often here, and I find that and a lot of it is a culture of morbidity and mortality rounds are what you did wrong. It's really hard to take on, especially if it's your case. So starting with one person and saying, let's talk about the case, whether it was wrong or right, or whether you screwed up or it was a great case, just having someone to talking to and getting that collaborating attitude makes a big difference. Be bold. I had to call Alistair at VSA recently. Well, it's who I ended up talking to. It could have been on any of y'all about a surgery I did. And I was scared to death to ask because I knew that he would tell me what I had done wrong. And I'm a pretty bold personality, and I was still scared to death. So that's what brought me to that fear and pride kind of thing. Be bold. It's gonna be scary calling and asking someone, hey, I did this, or I don't know about this. Be bold. The chain. So at my last practice before I moved here, doing ER medicine, we had what we called the chain. And it was basically at 2 in the morning. And with 7 patients waiting and 4 inpatients or 10 inpatients, you don't have time to figure out you don't remember those ophtho drugs that you should use for the cat who's got something inside. So we had a chain of veterinarians listed, ER vets, most of us, so we didn't mind being called at 4 in the morning. And they each had a specialty. Not a specialty as in a specialist, but something they were really comfortable with, or something they'd done a lot of, or they worked more with, or had done more CPD, and we could call them. So you could just text them and say, what do I do about this cat with these signs? And they could say, have you tried this and this? Or you could call them or email them, whichever way. No one needs to, but there's going to be a sheet in the back for anyone who wants to be in a group that we can say, this is me. This is what I think I could help with if you need help. This is the easiest way to get a hold of me. Now, not everyone's going to get this at first. I will contact all of you that actually want to be on that chain and say what doesn't work for you, what does work for you. So I have 3 friends who will call me at 4 in the morning if it's an ER question, because I know I'll go right back to sleep. Many people in here are not going to want a 4 o'clock in the morning phone call. So I will talk to each of you, probably by email, to find out what. But if you want to be involved in that, then that's how we'll start it and see if that works. So, and I think that's how we collaborate together. This is because we're all pieces of the puzzle. We will never make a puzzle all by ourselves. We each fit together intricately and on our own. And that's okay. We'll get there.